Are you still having joint swelling and pain even though your gout tests are negative? You might have pseudogout, and the key to managing it is controlling the inflammation before it causes long-term damage. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and protect your joints using the most effective low-risk approaches available. Today we're talking about how to treat chronic and difficult to control pseudogout, also known as CPPD, which stands for calcium pyrophosphate deposition disease. If you're still flaring, even on typical medications, it means we need to shift how we think about treatment. CPPD is all about inflammation, and if we don't control it, it doesn't just cause pain, it leads to permanent joint damage as well, possibly. Today, I'll walk you through the treatments that really work, especially when the condition becomes chronic and aggressive. So pseudogout starts when calcium pyrophosphate crystals build up in the cartilage and joints. These crystals trigger an inflammatory response in your immune system, leading to sudden pain, swelling, heat, and joint dysfunction. Unlike osteoarthritis, which is mostly mechanical wear and tear, CPPD is about inflammation. And that means if we cannot control the inflammation, the joint damage can accelerate quickly, sometimes even faster than what we see in rheumatoid arthritis. When inflammation goes unchecked, it doesn't just cause temporary pain. It starts breaking down cartilage, damaging bone, and altering the joint lining. We can see this on ultrasound or MRI. You see synovial thickening, that means thickening of the joint lining, chronic fluid or joint effusions, and eventually erosions, which is actual damage to the bone itself. This is the same kind of destruction we can see in other inflammatory arthritis conditions, such as rheumatoid arthritis or psoriatic arthritis. In CPPD, once the process becomes chronic, it no longer behaves like a simple crystal disease. It needs a full anti-inflammatory strategy. So the goal of treatment is not just symptom relief, it's actual joint preservation. And this is where DMARDs, disease-modifying anti-rheumatic drugs, come in for patients with chronic CPPD and recurrent flares. DMARDs can dramatically reduce inflammation and prevent future damage. First-line treatment for pseudogout tends to be colchicine, anti-inflammatory medications, and steroids for short-term control. But if your condition is flaring up again and again and again and is not controlled with conservative options, then we should be utilizing disease-modifying treatments. Most commonly used DMARDs in CPPD include methotrexate, foundational medication for inflammatory arthritis that reduces both flares and progression. Hydroxychloroquine is especially helpful if the inflammation is mild or if there are safety concerns with other medications. I mentioned colchicine. While technically not a disease-modifying treatment, this can help to prevent flares at low doses and is often used in combination. In more severe or refractory cases, biologics such as IL-1 blockers or TNF inhibitors can be considered as well. These are not used often in CPPD, but they may be appropriate if you're not responding to traditional DMARDs and have active inflammation in multiple joints. One way to know if someone needs a DMARD is by looking at objective signs of inflammation. Blood tests like your CRP and SED rate are often elevated. Ultrasound can show inflamed joint linings or persistent joint effusions or fluid in the joint. X-rays or MRIs may show erosive changes or joint space narrowing faster than expected as well. If you're having symptoms and we're seeing this level of inflammation that is objectively going on in the joint, the goal should be early treatment to slow that damage down. While medications play a very key and central role here in pseudogout, lifestyle changes help to reduce background inflammation and improve your overall response to treatment as well. Here's what I recommend. A Mediterranean diet tends to be lower in sugar, refined sugar, rich in vegetables, healthy fats, and lean proteins. Omega-3 and anti-inflammatory supplements such as curcumin and turmeric. Hydration and sleep is key. Both are essential in controlling systemic inflammation. Weight management, extra weight puts more stress on joints and worsens inflammatory markers. These are not cures on their own, but they do support the medications and make you more resilient long-term as well. We also need to screen for underlying conditions that might be making your pseudogout worse. These include low magnesium level, high calcium or parathyroid disease, thyroid disorders, hemochromatosis, which is iron overload. These conditions can all promote crystal formation and inflammation as well. If you're still flaring despite treatment, we want to be sure we're not missing a metabolic cause that needs its own specific treatment. What about injectable treatments? So steroid injections are typically given for pseudogout in acute inflammation situations. That's okay if given very rarely. The problem is that frequently steroid injections are given too often. That becomes a problem longer term. That then leads me to then consider other types of injection options that are healthier long-term for the joint. If one or two joints are chronically inflamed or flaring despite systemic medications, we can also treat those locally. In my clinic, we'll use regenerative treatment options as an alternative to steroid injections long-term. Platelet-rich plasma, or PRP, will help calm inflammation and support tissue repair longer term. Platelet lysate, which is a filtered form of PRP, tends to be better for inflamed joints as well as nerves, and tends to be a good option as well for long-term management of inflamed joints. Alpha-2 macroglobulin, or ATM, is a natural anti-inflammatory protein that protects cartilage from breakdown as well. These treatments are not standard of care for CPPD, but in select patients, especially when steroids are not tolerated or being used too frequently, and you're already trying to control the overall body inflammation with medication, the regenerative medicine treatment options can be a useful way to help manage inflammation in the joints in a safer way as well. Treating CPPD isn't about one magic bullet, it's about layering care. Start with medications to control total body inflammation, add lifestyle tools to support healing, use targeted regenerative therapy treatment approach when required as well, and screen for deeper metabolic issues. This layered and personalized approach gives you the best chance at preventing joint damage and improving your quality of life long term. If pseudogout is hard to control for you, that's a sign it's become a chronic inflammatory condition, and that needs a real strategy. Early, smart treatment can preserve your joints and give you your life back. If you found this helpful, please make sure to like, subscribe, and visit our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. You can also reach out through either our website or any of our social media channels if you'd like to explore personalized care options. This is Dr. Siddharth Dambar. Thank you for watching, and until next time, live well.